Please confirm, am I clearly audible to all of you? Okay, thank you, Dr. Suleiman. Thank you. Okay, thank you, Dr. Nadia. Okay, so first of all, welcome to all of you for this new journey in pediatrics. Okay, uh, first of all, I'm going to introduce myself a little bit, okay, before we will going for orientation session. My name is Dr. Aisha Osama, and I have completed this whole MRCPCH journey in 2023, Alhamdulillah, and blessed with the degree, MRCPCH degree in December 2023, Alhamdulillah. So from then onwards, I have started, teaching MRCPCH, and I have been teaching since 2 years, and it's our fourth batch or a fifth batch. I'm not 100% sure. So we have already done with multiple batches previously, and Alhamdulillah, our result is almost, close to 100%. Maybe one or two candidates, were unable to pass in first attempt, but surely they have done it in second attempt. Okay, but most of it, alhamdulillah, done it in first go. Okay, so MRCPCH teaching, it's alhamdulillah a good experience. I have it, alhamdulillah. Along with the MRCPCH, I have done MCPS pediatrics as well, and I have completed my FCPS training in pediatrics as well. And just exam, inshallah soon I'll attempt the exam as well. Okay, currently I am in the Saudi Arab, and I have been searching for the job over here because of my family. I just shifted over here, not go to the UK, but soon, inshallah ta'ala, if Allah wills, I will definitely move to UK soon, inshallah. Okay. So, what is the benefit of this MRCPCH? I think you all of you know that we have two types of degrees are there. We have DCH as well. This is also UK based degree. MRCPCH is also UK based degree. But what happened that DCH has two attempts. You have to take one is the exam for theory, and one is the clinical exam. But for MRCPCH, you have two theory exams and one clinical exam. Okay, so you have 3 steps for MRCPCH and 2 steps for the DCH. Okay, but what is the disadvantage of DCH is that you will not get the license to practice in UK. Okay, you will not get the GMC. Okay, so what is the GMC? GMC is just like your PMDC that will going to allow you to practice. Okay, so you will not get that GMC. You just have the degree, DCH degree. You can show it, but this degree will not help you to work in the UK. Okay. While when you go for the MRCPCH, okay, then definitely you will get the GMC after passing the exam in just 2 to 3 months, and then you can apply for the job and all that. Okay. Other important thing, for the MRCP before MRCPCH, definitely, this is the theory exam. So for the theory exam, I would like to mention one of the very important thing is that those who are in the beginners, or those who are have just started their career as a pediatrics, they don't have any clinical experience a lot. Okay, either they have in the first year training, or maybe they are RMOs. So don't worry about it. You can done with theory exam, inshallah, with us, inshallah. Okay, for definitely to pass a clinical, you need some background training. That is the best thing. If you have a background training, that would be very very helpful in passing the clinical exam. Okay, but if those who are not in the trainings, those who are RMOs, but they have pediatric experience, and if they will work hard, definitely they can also done with the clinical exam with proper guidance. Okay, so the guidance is actually the key to pass the exam. Okay, nothing other important thing is that I don't believe that any exam is difficult. If you have a proper way, if you have a proper guidance, you can easily done with any exam. Okay, so don't think like that. We have a little experience. How can we go through this exam? But yes, for those who have little experience, like for example, they are in beginner phases, like first year or second year training, first year or second year RMOships, whatsoever, what I'm going to advise for them is that don't give exam in 3 months. Okay, at least give time to your studies properly. Even though we will finish our course in 3 to 3.5 months, but you have opportunity to take this course twice. So better to take it twice, better to give 6 months duration and then attempt it, because you already know that the fees of the exam is around, it crossed the 3 lakhs rupees. Okay, so definitely it's not easy for everyone. Okay, only 5 or 10% people are born with having spoons, born with gold spoons and all that. Otherwise most of us are struggling phase. Okay, what I have done, I have alhamdulillah passed my exam, all my exams, part one, part two, clinical for MRCPCH in first go. But I know how I gave the exam fees. So it was a really difficult, and most of us in a struggling phase. So that is why don't go with the premature attempts. Okay, don't be in hurry. You will not go to the UK quickly once you pass the exam. Everything is pre-written. We have a strong belief on it that everything is pre-written, so take it slowly, gradually. So take 6 months duration for those who have little experience, but those who have done their FCPS trainings, those who have done the FCPS parts, those who have done the MD training, done with the MD exams, yes, they can take this exam within 3 month duration. Okay, okay. So when we are talking about the first part, the part one exam, let me share my board with you, whiteboard. Okay, okay. If you have any questions at any time, you can unmute yourself and ask it. Okay, don't hesitate. We are here to study as a friendly way. Okay, but definitely we have some limitations as well. What are the our limitation is that you can ask any question during the class without any hesitation. And second important thing, if you have any question other than that, you can only send it on the group. That is my personal request with you people, that whatever question is coming in your mind, even if you feel that you are losing your hope, you are feeling very saturated, you are feeling very difficult, this pathway, everything, whatever comes in your mind, you can send it only on the group. Please don't send me personal messages, because I've received so many messages. I'm not able to give personal answers to everyone. But if you share it on the group, so on the group, it's my responsibility to reply it as soon as possible for me. Okay, so that is why you can feel bilkul freely on the group only. Okay, so what I want to say over here, we want to talk about the MRCPCH. You can see, I think board is visible to you, all of you. Okay, so this part MRCPCH, we have part one. Okay, so I'm just giving you orientation a little bit. It is further divided into FOP, this is foundation of practice, and second is the theory and science paper. Okay, FOP and TAS. Second, we have part 2 paper, okay, which is also called AKP, okay. It also has two parts, part 1 and part 2, okay. Then we have the third is the clinical part, okay. So now, first of all, very important thing before about exam. Okay. So if you are planning for your exam, first thing what you will going to do, you will first of all make RCPCH account. What you will going to do, this is very, very simple. Many videos are on the YouTube channel, how to make RCPCH account first. Okay. So this is the first step. If you are planning for this exam, you have already registered it with us. But very important thing is that you should register with RCPCH as well. Okay. This is the first step. What is the second step is that second step after RCPCH account, most of the students did not know about it, that you should go for registration process separately. Okay. Registration process is not included in RCPCH account. RCPCH account will ask you some basic information, and then you will be received an RCPCH number and the password. Okay. But registration process required only one document, that is your MBBS degree. Only one document. So those who are thinking that we don't have any experience prior, we don't have any degree, nothing. You just require MBBS degree in English form, in English. Those who have done their MBBS and their degrees are not in the English, they must convert it into English, and then you have to upload it in the English form in the registration process. Okay. Once your registration will be done, then only you can apply for the exam when the exam window will going to open. Okay. So exam window, definitely the timing of that exam window is, open before 2 months. Okay. Before 2 months. So if you have exam in the February, then definitely we will definitely share the exact dates on the group with you people, but that dates are also mentioned on the MRCPCH group as well. Okay. So this is the very, very basic information that you should know prior to apply it applying it. Make an account, done with the registration process, and then you'll be relaxed that when the examination period will open, then you can apply for that. Okay. Now talk about these different parts. What is the difference between it? So when we talk about the part 1 and the part 2, as I mentioned, that is further divided into FOP and TAS. Okay. And part 2, that is AKP, is also divided into two parts. What is the difference between it? Difference between is that you can take any part. Okay. Theory part, these both, the part 1 and the part 2, these are your theory. Okay. So you can take any theory part at any time, at in any order. Okay. If you want to take AKP first, you can take AKP first as well. If you want part 1 first, you can take part 1 first as well. Okay, so in any order. But listen again very carefully, that the best approach, the best way is start with the part 1 first, then goes to the AKP. Why? Because part 1 is asking about the basic informations, the part 1 is asking about the diagnosis, while AKP is more related to the interpretation of the labs, different type of labs. It is asking about the management more. So it asks about more clinical perspective. Okay. So if you start with basic part, then goes with difficult, that would be more appropriate for you. Okay. So but for those, as I mentioned, already done with the FCPS exams and all that, they can take the exam in any order because they have already, already done with the clinical part as well. They have done with the theory as well. So for them, they can take any part. But for those who do not have any prior clinical experiences, those who didn't attempt any exam, Pakistani exam for pediatrics like MCPS or FCPS, so don't go with AKP first. Okay. Now, with the part one, further it is divided into FOP and TAS. Okay. So you can take both FOP and TAS simultaneously. You can attempt for FOP separately and TAS separately as well. Okay. So you have three options. Either you can attempt for only FOP, for only TAS, and for both FOP and TAS. Okay. So what is the best approach? Best approach is that if you are as a beginner, starting as a beginner, okay, best approach is take both exams simultaneously and give 6 months duration. This is the best approach. But sometime what happened, those who are already in the trainings, first year training, second year training, they don't have that much time. Okay, for them the best approach could be that they can start with the FOP because this is more clinically relevant. Okay, and then they can take tasks onwards later on as well. Okay, so these are the two different approaches. You can take it separately as well or simultaneously, but if you take it simultaneously, it is a little bit budget friendly. There is a difference of around 1 lakh fees. If you take it simultaneously, the fee would be 1 lakh, comparative, will be less comparatively. If you take it, separately, it's just about the fees. Other expenses like your traveling expenses, your examination, where is the examination center you are getting, that is all separate. Okay. Now, for the AKP, definitely you have to take part one and part two simultaneously. You don't have any option to take it separately. And for the part two and AKP, we have a different, mentor for that. Dr. Fatma is, taking AKP. So she will discuss it more. I'm going to talk more about the first part with the starting journey. Okay. Now, how to take the exam? Okay, so I've already tell you the budget around the fees, already just a rough idea that if you take it combinedly, then it will cost around more than 3 lakh something. Okay, exact fees are in the pounds, and that will all mention in that are all mentioned in your website, so you can check it from the website as well. We can also share it with you on the group as well. Okay, now how to take the exam? Next part is that we have two ways. Prior, what happened that at the time of corona, so we talk about all this. If you have any questions, you can ask. Okay. Now I want to talk about that we have two ways. You can take the exam online and you can take the exam in the exam center. What is all about it? So what I was telling, at the time of corona, they have introduced the online invigilation system. Okay, invigilation system for overseas, for all overseas. It include Pakistan as well, India as well, all other countries. Okay, so that was introduced at the time of corona. That what happened after, up now they are preferring that you should go for the centers. At that time, the exam were not happening in the centers, only invigilation, online invigilation option was there for all overseas. Okay, but now, because of now corona is and everything is okay, so now they are preferring to go with exam centers, but still they have options for online invigilations for all overseas with limitations. Okay, so this is not for everyone. So what are the important limitations? That if you have any underlying medical reason that you cannot go for examination center, or you are living away 200 miles away from the center, in your city or in your country, depends. Okay, so if you, for example, if you are living in the interior side of Sindh, and you are 200 miles away from Karachi, from Multan or something, then only you can apply for online invigilation system. And for that, they have a very strict checking for that. They will check the bills and all that, and in the bills your name should be mentioned, that the property should be on your name, and blah blah blah. So many limitations are there. For those details, of course, Dr. Farhan will guide you more for that. But now we have 4 examination centers are there. We have an exam center in the Karachi. We have exam center in the Multan. We have exam center in the Islamabad. And we have, I think, what I can recall is the Lahore. So we have 4 examination centers are there. And if you are living in the Karachi, then there is no chance to have to apply for online invigilation, because you are close to the center. Your home is less than 200 miles away from the center, so you cannot apply unless you have any medical reason, which you should mention it. Then only they can consider for it. Okay, so now online invigilation system is only for the limited people. Okay, so this point must be cleared. Okay, now we'll talk about how we will going to prepare and what is the way to prepare. I've already, in detail, I've discussed the duration. What should be the duration of the our study? Now we'll talk about the different books, which books we will going to follow, what would be our study strategy for that. Okay, so see, we have, as I mentioned, that we have, I'll discuss separately, because you know what happened, some people are taking only FOP. So I'll first try to talk separately the preparation for FOP, then for TAS, and then I'll discuss the combine as well. Okay, so for combination as well. So let's start with the FOP preparation. FOP preparation. So what is the name suggest for? It's the foundation of, practice or pediatrics, foundation of pediatrics, I think, or a practice. I forgot. I think it's practice or pediatrics. I'm not 100% sure. Anyways, so this is the practice. Thank you, Dr. Sir. Thank you, dear. Okay, so it's the foundation of practice. Okay, so this name is this. So see, this is the foundation. So mostly they are asking about in your exam, mostly clinical type questions, not a very basic question. So clinical questions mostly would be related to the diagnosis. What is the diagnosis? Basic management, basic, not in detail. Basic management, diagnosis, and they can ask about the investigations of choices. Okay, investigation of choice. But definitely they will not going to ask the basic part, like pharmacology, like pathophysiology. So they will not going to ask anatomy in this section. Okay, so that is why I'm saying those who are in the training, and if they want to, if they don't have time so much with the training, and they want to give exam and they want to start their journey, they can start with FOP first as well. Okay, so this is the exam related idea, that what is in this exam. Now what you will going to follow with that. Okay, so we have, first of all, definitely lectures will be definitely there. Okay, but along with the lectures, what are the different resources? Very important thing is that when you are taking the lecture, focus only on the lecture. Don't try to write, don't try to make notes. you will get the PDFs. Okay, so you will get the all the PDFs with you. You can take out, print out your PDFs will be with you. So there is no need to write. Already the lecture is of 2 hour, 2.5 hour lecture. So if you will write along with that, it will take so long, and definitely you will get fed up. Okay. So focus on the important points when you are listening the lecture. Okay. Now, another important thing is that I've already made the lectures from your important books. Okay, so all that material will be in your book. Okay, so what are the important material which you will going to follow with that? The first thing, the textbook, which is the for FOP. So I'm talking about FOP. We have illustrated textbook of pediatrics. Textbooks, it's X textbook of pediatrics. Okay, you will get the Google Drive in which you will have the soft copies of all those books which will I'm going to mentioning over here. They will all there in the soft copies, but definitely those who are prefer to read from the book, they can get the hard copies easily from different medical stores. Okay, so illustrated textbook of the pediatric is the book, which is a textbook, and you have to read the chapter from it. Okay, so we will going to cover systematically. Okay, now, if we talk about the first, we will opt this first system like cardiovascular system. You have to read the chapter, you have to take the lecture first. Okay, then you have to read the complete chapter from illustrated textbook of pediatrics. And believe it that you will not get bored when you will read this book. Okay, it's not like a Nelson. Many of the people ask this question that, doctor, should we cover Nelson along with that? So Nelson is an American board exam. Okay, it's for American board. This is your UK board. This is NHS system. This is UK system. Both systems are different. Okay, so there is no need to follow Nelson. There is no need to read the Nelson book. Okay, Nelson is for your FCPS exam, for your American exams. Okay, so don't read it. Don't think that when you will read this illustrated textbook of pediatrics, you will see that your chapter will be finished in just one day, and you will be maybe thinking that this is only a small information. So will that be enough or not? Because most of the candidates have already done the part 2, and they have read so extensively, so they think that, oh, this is so simple, so easy. Will it be enough for this international exam and all that? Yes, that would be enough. And we have other resources as well. So whatever the resources I'm talking about over here, just focus only on that. Don't go in too much detail. Believe it. Our system, in our system, we work extensively hard. Seriously, extensively hard. And once we are goes in depth, we actually forgot the basic things. That's the basic. You can say that system flaws, that we don't know the basics, and we are reading so detailed books, so textbooks, Nelson and all that, that most of us did not retain anything after finishing a chapter. So if you will finish the CVS after 1 week, if someone asks you about different concepts, different management, most of the things you will not able to recall it. That is the flaw of the system. Okay, of the so in this exam, you will covering from the basics and the important things, and you will see that you will learn, you will enjoy this journey, inshallah. Because people, most of the people, if they start with the Nelson, they seriously have a phobia with the studies. They feel very difficult to study and all that. But if you will start from the beginning and then goes little bit onward, you will feel that if you understand, if the things are making sense, then definitely that pathway, that journey will be easy for you. Okay. So the first thing I've talked about the textbook, you have to cover the cardiovascular system from this book. Okay. Another book, so this is the first book. What is the second book you should have is 50 clinical cases, 50 clinical cases for FOP. So for foundation of practice, you have separate book which is called clinical 50 clinical cases book. Okay. 50 clinical cases book for the FOP. Okay. So this book is containing 50 cases. Okay. What you will going to do is that you will going to cover the cases systematically. Okay. In this book, the 50 cases are not systematically arranged. They have given in the random order. First case would be of poisoning, second case would be of cardiovascular, third case would be respiratory. So what we will going to provide, we will provide you a PDF, a one file in which the cases numbers will be given along with their system. So for example, in that PDF, if it is written cardiovascular, they will going to mention that the case number 3, case number 5, case number 7, that is related to the cardiovascular. So you will cover only the cases which are relevant to the cardiovascular system first. Okay. The third book which you will going to follow with me is the guideline. So we have a book called Pediatric Guideline book, which is in a hard copy as well. Okay. We have a separate hard copy as well for this. Soft copy, definitely you will get it on the drive. Okay. So this guideline book, we have two guideline books, pediatric guideline book and the neonatal guideline. You don't need to cover whole guidelines, everything from the guidelines, no. But we will cover the important guideline from each system. I will share that these are the guidelines which you have to cover. I will mention it in our lecture as well. I will separately mark the important guidelines for you as well. I will share those as well. Okay. So you have to cover, for example, if we are covering cardiovascular, so we will not going to cover all the guidelines related to the cardiovascular. We will cover 2 or 3 important guidelines from there. Okay. So the important pediatric guidelines. For the neonatal one, when we will going to start neonatology section, which then only I'm going to mention that you have to cover some guidelines from the neonatology, some guidelines. It would be around maximum, it would be around 8 to 10 guidelines maximum, okay, from that book. That book contain obviously so many guidelines, but you need to cover some topics from it. Okay. So that is the only, okay. So you just have a first resource would be the lecture. Okay. The second resource would be your textbook. The third resource would be your 50 clinical cases. And fourth resource would be the pediatric guideline book. That is all. Don't go beyond it. Okay. If you will go too much beyond it, you will get confused. You will be out of your pathway. Then definitely, you will not able to recall the things during your exam. So if you have limited information, important information, you can easily recall it. Okay. I've already made the lectures from your textbook. In the lecture, your textbook is also included, 50 clinical cases are also included, guidelines are also included. So many things are included in the lecture, okay? That is why I mentioned that don't try to make notes from it. Just focus on the lecture, okay? Just listen it very carefully. Try to try to clear your concept in whatever phase you are. Even though if you have just finished your house job, you are just entered in the pediatrics, still don't hesitate that other candidates, what will they think if I ask this question. No, as I mentioned, clearing your concept is the key to pass this exam. To reach the clinical, if you want to conquer your clinical part, your theory must be very, very strong. Your concepts, we don't need a very big concepts. We need a basic concepts. So if these concepts will be cleared, then only your pathway will be, inshallah, easy for you. Okay. So we have talked about the FOP in detail. Now we talk about how we will going to study for TAS exam. So now for the TAS exam, what is important? See, when you will open the TAS, okay, um, the TAS is basically, the name suggests theory and sciences. See, TAS, okay. So this is again theory and sciences, okay. So this is the exam that you need a basics, okay. So what do you mean by basics, doctor? Should I need FCPS part 1 information? Should I go back, revise my part 1? No, no, no. Okay, they don't want FCPS part 1 in detail. No. So anyone if does not have any FCPS part 1 exam preparation or no experience with this exam, don't worry about it. Basic exam is relevant to the pediatrics. Okay, so they will give you the cases from pediatrics. Okay, for example, I'm just giving you one example for that, how they will going to ask about this exam. They will give you a very big scenario related to the asthma exacerbation, that the child was having any exacerbation, shortness of breath, they landed in the emergency section, and nurse have given the salbutamol and the oxygen saturation was improving from this to this. So what is the mechanism of salbutamol? So this is the basic information that they're asking about, the pharmacology. What is the mechanism of the salbutamol? How it works? So you see, clinical scenario is there complete. Your information is related to the pediatrics, okay? Pediatric child, the medicine used in the pediatric population for asthma, and they ask about the mechanism for that. So your task part is 50%. 50% is from pharmacology. Is from pharmacology. So how I'm going to cover pharmacology? So I'll tell you the resources. Don't worry about it. I'm just trying to mentioning over here that the basic, the most part, if you will going to focus on, some, there are some important files are there, some important sections are there. If you will just focus on those points, you see, you will cover 50% of the task, pharmacology. Other part for theory and sciences, definitely some quite very, very limited questions are coming from the anatomy, maybe 5 questions maximum. So you don't need to revise Snell and blah blah, those books are not needed. Only the basic anatomy, which we will going to tell you during the lecture, that would be enough. So the lectures would definitely, they don't, you don't require extensive information related to the anatomy, related to the physiology, related to the pathology, but the important information will all be in your lecture. Okay, so the first resource definitely for the task would also be the lecture. Okay, after the lecture, as I mentioned, it will be mentioned what anatomy you need it for your exam, what type of physiology, what important section from the physiology you needed. So that would all be included in your lecture. Second, again, the textbook for the task is, we have a SOP book. SOP book, the full name is Science of Pediatrics. Science of Pediatrics. Okay, one thing I'm going to mention from my previous batch, one of my candidate, okay, she has cleared FCPS complete in pediatrics, okay? And what happened to her? I'm not giving her example for, for any, I'm just giving for your learning, okay? So she has done with the FCPS part 2, but she got more than 80% marks in the FOP section. But unfortunately, in first attempt, she failed in the TAS exam. Okay, so why she failed in the, and what happened with the next attempt when she took it seriously, this part, she got more than 90%, the highest marks in complete batch, previous batch. So she got the highest mark with, in the previous batch when she attempt in the second. So why you should take each and every part seriously. Okay, it does not means if you are taking it simultaneously, if you are covering more FOP, tasks will easily cover out. No, 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 you should focus on the important points which I'm mentioning over here separately. Okay, don't take the exam. Okay, just a second, I'm coming. Just a second, just a second. Okay. Okay, so we resume for the task. Okay. Okay. So we were talking about the task part. Okay. So for the task, for the task, what I mentioned first is the lectures. Second, we have a textbook, Science of Pediatrics. But what happened when you open the Science of Pediatrics? It would be very difficult book. Would be very difficult. So only covered pharmacology part. See, I've made the things easy. You don't need to read anatomy from it. You don't need to read embryology from it. You don't. So if you open the first chapter like cardiovascular system, you will not going to read anatomy. You will not going to read embryo, physio, patho. Directly goes to the pharmacology part from the cardiovascular system. Just read that part only. Whatever important anatomy, physio, pathology, Whatever important they are asking, it will include it in the lecture already. Okay. So just focus with this textbook only pharmacology part. So if you take it seriously, the pharmacology part from this book, that would be more than enough, inshallah. You will not face a difficulty during your exam. Okay. The third important thing for the task is, again, you have separate book, 50 clinical cases for tasks. So for tasks, you have separate book. For FOP, you have separate book. Again, PDF will be there. And if you are covering cardiovascular, they have separate cases for cardiovascular that will be mentioned over there. You just need to read those cases with the system. Okay. You will not going to start with case 1, then case 2, case 3. No. Do it in a modular way. Do it is in a systematical way. That would be the best way to retain the knowledge. Okay. So if you're done with the 50 clinical cases and science of pediatrics and the lecture, that is the only resource. That's the only resources for the task. Okay. And in the end, we will going to provide you a pharma jury notes. Okay. So these pharma jury notes, they will be basically a previous exam questions related to the pharmacology only. So they are exam questions previously asked in the exam that were, in the previous parts. So you just need to cover the pharma jury notes, revise those notes, ratify those notes for the pharmacology. So your basic focus on the only pharmacology sections from SOP, the pharma jury notes for the pharmacology, and 50 clinical cases for the task book. So these are the important resources for your task. Just 3 resources along with the lecture, science of pediatrics, 50 clinical cases. But pharma jury notes, you can keep it for the last month. Okay. So just focus on only these 3 if you are only planning for the tasks. Okay. And now I'm going to talk about if you want to take the exam simultaneously. Okay. This is the preparation for those if you got the seat separated. Like, for example, if you got just TAS seat, just FOP seat, then you should focus only on those resources which I mentioned. But initial phases, definitely, if you are planning for both exams simultaneously, FOP and task, then what would be definitely your approach? First of all, then approach will be definitely a combination which we just discussed. Start with the lectures, then you should first read the illustrated textbook of pediatrics, then cover FOP plus TAS clinical cases from both book, then cover pharmacology, because pharmacology is the thing which you just need to ratify. Pharmacology from SOP book, and the last you need guidelines relevant to the system. That's the whole way to study the one system. If you are take cardiovascular, like in this approach, you will going to follow it. Okay. In the last, what would happen? Definitely you need a practice questions. Okay. Exam questions. So we will going to share a separate file. If for example, if cardiovascular we are doing, I'll send a separate file for FOP, cardiovascular FOP, on cardiovascular task file, which are previous exam questions which were asked from 2023 to onwards. It is a 10-year or something, very around 10 year. It is covering previous questions. Okay. So they all are exam questions. In the end, you will going to solve those practice questions. Okay. Relevant to that system only. because after 2023 we have 2024, 2025. We will going to discuss these papers separately after finishing our course. So once we finish our course, complete course, then definitely I'm going to discuss 2024 and 2025 papers with you, inshallah. Okay, so this practice question you will going to solve it, and then I am also going to discuss it with you people as well. So what would be our approach? Our approach would be that we will try, inshallah, Monday to Thursday. Monday we will give each system a week. Okay, so for every system we have already shared you the timetable how we will going to proceed. We can also share it, but already it is shared. So we will cover the one system per week initially, then later on, the for the smaller systems we can combine, like for example we can cover two per week as well. Okay, but initially, like for example the big systems like cardiovascular, respiratory, the CNS, the these nephrology, these are the important big systems, endocrinology, we will give one week to each system. Okay, any questions? Okay, kindly unmute yourself. Okay, so we will going to inshallah cover each system per week. You will have enough time to cover all the material from the resources. Okay, what happened Monday to Thursday, I will try to finish my system, inshallah. Okay, Friday and Saturday. On Thursday you will receive a mock. Okay, you will receive those that file, separate file, FOP and TAS file, which is exam file, which contain exam questions. I didn't make it, these are the exam questions. Okay, you will receive those exam question file on Thursday. It will be with you, but by Saturday you should try to solve it by yourself. Okay, don't think that I'll make so many mistakes. Go through that file, please go through that file. Please try to attempt that file. Whatever you solve it, shared it on the group. Okay, it should be on the group. You can just directly write the answers on the white paper or a blank paper and just take a picture, send it on the group. That will show your participation. Okay, that you are actively taking this exam seriously. If you will going to take small targets seriously, then definitely a big target will be easy for you. But if you don't take that mock, that exam serious, don't take it seriously, you will not going to solve it. If, then what would happen? You will going to lose it. I'm not going to lose it. On Sunday is the fixed day. Okay, Sunday is fixed for the recalls discussion. Okay, so the file which I have shared on the Thursday related to cardiovascular, related to respiratory, whatever, I'm going to discuss that file inshallah on Sunday. 2 days off will be there, Friday and Saturday off will be there, so that you can cover your material, your resources along with the lecture. Okay, so that is the way we will going to follow this course, this inshallah. And our duration would be inshallah 3.5 months, inshallah. If you have exam in the February, then definitely by the end of the January our course will be inshallah finished. We will try to finish by the end of the January. In the February we will discuss only the recall papers with you, like for example 2024 and 25 recent recalls paper only with you. That is our whole strategy. Okay, so that is from my side. Now you can ask any question if you have in your mind. If you feel that any query in your mind, you can discuss with me. No worries, without any worries. Okay, Yes, Zoya. Anyone, any question in your mind? Suleiman, Seher. If you have any questions, you can unmute yourself. You can write it on the chat as well without hesitation. MRCPI, Dr. Farheen Osman, MRCPI, actually, I didn't give that exam. Okay, seriously. But definitely, the course would be very similar. Okay, so if you will follow the books, only the different thing would be their recalls. Okay, so maybe you need to struggle little bit more hard to find out those recall papers and solve those recalls. Okay, because the knowledge is almost same, but definitely you have to, for every exam you have to cover their exam questions. Remember it. Even though whatever knowledge I have it, if I'm attempting for FCPS, I have to go through their exam papers, their recall papers. So along with the basic knowledge, the books, what you add only is that the exam questions. That is okay. We are covering only over here the FOP and TAS. Okay, so this is the part one group. AKP group is separate. That is covered by a different mentor. Okay, Dr. Fatma is covering from our group. Okay, so that would be the different. But I didn't give this exam, so that is why I'm not 100% sure that whether it is how much similar is it or not. Okay. Yes. No questions. Everything is clear to everyone. If everything is clear, then I'm going to end the session. If you have any queries, you can ask it. Okay, that's great, sir. Okay, so now our plan start with Monday, inshallah. Okay, so we will start with the cardiology system first. Okay, we will share solve mock, very thorough session. Okay, that's great. We will share solve mock till
I have a
Saturday
question.
afternoon. Yes, you can ask. Yes, Nadia.
While booking exam, is there any option like if we're booking for the FOP and TAS together, then will there be any option like if we are booking, there will be option like FOP plus TAS, or we have to book them separately?
No, we have three options. When you will open your file, there will be three options will be there. FOP plus TAS Islamabad Center, only FOP Islamabad Center, only TAS Islamabad Center, FOP and TAS Karachi Center, FOP only Karachi. So you will get like these options will be there like this.
Okay, thank you.
Okay. So another very important thing that exam booking is very, 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 challenging, very challenging. We have already made a video as well, and before the examination window, I will again tell you how to book the exam, because those who are weak in operating computer and all that, because medical students are not that much, good in operating computers and all that. You just have 1 minute to get the seat. 1 minute. If you will not reach the target in 1 minute, you will lose the seat. You will lose the seat if you will not reach the appropriate target in 1 minute. So we will going to inshallah tell you that as well. We have already recorded video as well for that. But before exam, we again made a video again. I'll tell you, live again, so that we can just help you. Everything is as I mentioned. If you got the seat, if you didn't get the seat, it's all pre-written. It's all pre-written. So just trust on Allah. Whatever better will be with you, whatever be better for you, Allah will inshallah guide you towards that. Okay, so don't be, lose the hope if you are not getting seat in this session. Try it next, but keep trying. Don't lose the hope. Okay, so we can just help you. Okay, other thing what you are asking is that mock. We will share solve mock till, yes, you can share mock till Saturday, till Sunday, but I'm going to discuss it on the Sunday. So if you are very serious for exam that yes, you want to take this exam, try to share it by Saturday. So once I will start discussion, you already have gone through those questions, those and if you have already gone through the questions, whatever is not clear already, the questions will be in your mind. So when I discussing those questions, you can easily clear your concepts. You can ask, but if you don't go through it before, then definitely you just listen it and everything will be passed away quickly. So that is why it is very important. What I don't want, I don't have any time to give you marks to check your answers. That is for your practice. That why I'm giving it before, so that you have already gone through it. Once we are discussing, everyone has their questions in their mind, so it would be a very healthy discussion with you people. Okay, so the more you participate, the more if you definitely, if you what I would say that if you are eager to learn something, then we are here to help you out. Okay. What about Zoya? About TAS? You have said only pharma in cases we don't have to read all the description. No, you don't read it, Zoya. That is important thing. That we need to cover only the things which are important. If you go in detail, then definitely what is the purpose of this group? Why we are over here? Why we are taking money from you people? So definitely we have worked hard now. We have already seen the different, 10-year, 15-year recalls already, whatever they are giving in the exam, what they are asking in the exam. So we are here to concise your preparation. So that is why I'm saying that for the task, you don't require in detail knowledge. Lecture, FOP cases, pharma jury notes, and only pharmacology section from SOP. That is more than enough. Okay. Okay. Any other question? Yes, inshallah. So what I'm saying that my colleague, I was also shocked. I didn't get 80s or 90s marks in the task at my time. Definitely, I gave exam in 2022, I think. So I even forgot that as well. So so what I was saying when I was, seeing the score of my candidates, I literally asked them, did you do it anything extra? Whatever I told you, they said, no, we didn't do anything extra from it. That was more than enough. Man, that's great. PDF book, their PDF books file will be shared with you very soon. Google Drive will be shared on the group soon. And you can order for example, if you are living in the Karachi, then Winco Book Center is there. For the Lahore, I don't know exactly the center, but Dr. Farhan definitely will tell you the shop name. You can get the hard copies from there. Okay. But those PDFs, whatever I mentioned, everything will be shared soon on your group. Hey, see, this is only a chapter. No, I am not talking about only a chapter of pharmacology. Separate chapter. You see, if you open the Farheen, if you open the cardiovascular system from your SOP book, in that cardiovascular system, they have heading is there related to the anatomy. There is embryology. There is the physiology. There is also the pharmacology. So that pharmacology part is important. You got it? There is the pharmacology. Yes, pharmacology chapter is also there. You will read that as well. But system wise, every system also has pharmacology in it. So you will focus on that as well. Okay, because what where we lose, definitely we lose. We don't know the mechanism of action. We don't know the important side effects. That will all be mentioned in that book. That is only relevant part. You don't need any other book for the pharmacology. Whatever they mention in that book, that would be more than enough, inshallah. Okay. I think Fari, now you are clear about this part as well. Okay. Okay. So I think the strategy is clear to everyone. We will meet inshallah after 3 days, Friday, Saturday, Sunday. Yes, we will start from the Monday. So what would be your homework? Your homework is that you try to book your hard copies and start with the cardiovascular. Start from illustrated. Just cover the cardiovascular system from illustrated textbook of pediatrics, a very small homework. And then we will inshallah start with the lecture on the Monday. And if you have any queries, any questions, be very, very free on the group and you can ask everything on the group. Okay. So thank you so much, everyone. Jazakallah. Allah Hafiz.